So if you find yourself in kind of a rut as a therapist, like you're doing the same routine a lot of the time, one of the best things you can do is just change your, like, the thing that you start with. I'll do that a lot when I have a lot of clients in a day. But with that being said, I'm going to start with the arm actually, and I'm going to go right in with my oil. And as much as possible, just encourage your client to let their arm be really heavy. And let them know that you got them. And you can turn the arm a little bit as you need to make sure that you have the oil where you need it. I like starting with just some gentle effleurage for the arm. And this is a really easy way to anchor the arm as well, because you naturally have to hold the wrist. Also bring the arm out a little bit if you need just a more opened position as you work. And you can work on the triceps a little bit, just circles. You're forming a claw-like shape with your hand, using as much surface area of your fingers as you can. You're going to need to use a little extra finesse if you don't have a ton of oil. You probably need to slow down your movements a little bit more. And I like to have the arm over the table position when I'm working on bicep, deltoid. You can just levy the arm as you need things to be a little more open. Doing circles for the deltoid using as much of my thumb as I can. Working my way down the arm. Circles. You can even use your elbow to move into the triceps a little bit more. You're in kind of a perfect position here to work on the teres minor and major. But I want to do it in a pretty gentle way. Not dig in too much. Can be a really nice thing to include when you're working on the arm, especially a deltoid. You can also do more static holds in here. Make sure when you kind of throw in a wild card like working on these rotator cuff muscles, just find as smooth of a transition as you can back to the arm. My favorite way to do that is just to wrap my hand around and work on that deltoid a little bit more. On this second pass down the front of the arm, I will usually check in with that bicep tendon and just do a little active release. And a pin and stretch doesn't, mean pain. It just means lengthening to whatever degree your client wants or needs. If I spend a longer period of time on the arm, I'll usually grab a little bit more oil that tends to absorb. When I'm doing these effleurant strokes for the extensor and flexor muscles of the forearm, I like to really broaden my stroke around the elbow. Because it just feels so much more satisfying than these shorter strokes. So there's different ways that you can go about this. You can find a seated position where you have more access to those extensor muscles, or you can even just use your forefinger to work those extensor muscles. It's not going to be as specific, but sometimes it's just a perfect technique. Especially on someone that doesn't necessarily need really detailed work in there. This is obviously a really good position for the flexor muscles. They're just nice and exposed. You can do some really good work in here. Don't worry if the fingers move, that's totally normal. If your fingers are starting to feel kind of tired, you can actually do some really nice work on the hand with your elbow. You can just slide your elbow down. Be a little trickier if you don't have enough oil. This is really great for working the heel of the hands and not burning your thumbs out. If I am really arm focused though in a massage, there's something about having the thumbs work the palms that feels so good. I usually just go for it. You can do fast alternating thumb strokes. You can slow it way down. I really like to press on this area in between the thumb and forefinger. Can relieve a good amount of tension in those flexor muscles. It also can help with headaches, oddly enough. Press. I like to slow it way down when I finally reach the fingers. So I'm just pulling enough to open up the joints very gently. Always a good idea to just do something that makes your work in a specific area feel complete. And this is my favorite move for the hands. And we are going to go ahead and do our work in the upper back. If I start with arm, go through the whole routine, I don't do a lot of dry work for the warm-up of the next area that I work on. Just go right in with the oil. And even if I am upper back focused, I like to do a little bit for the entire back, but keep most of my oil up here. It might literally be like 2 or 3 effleurage strokes down the whole back. And especially if I'm more arm focused, I like to just throw in a few effleurage strokes that include the arms. It also helps tie everything together more if you start with the arms. And you can apply these effleurage strokes however you need to. I'm going to shorten them way up and just focus on this upper back. This is a great technique if you find yourself running out of time. This is just a great compressive effleurage stroke that feels good and also works the muscle tissue in a really nice way. If I don't have a lot of time, I try to pull out as many techniques as I can where I can just stay at the front side of the table and work both sides at the same time. If someone doesn't have a specific pain or it's that kind of a massage, I'll work both sides at the same time if I'm short on time. It can feel amazing to do compressive circles for the rhomboids. And I really like to work these levator muscles, but in a pretty gentle way. This is my favorite technique. I want to keep it really simple. So just in general, anytime that you're moving away from the shoulders, you're not going to be working on the levator muscles. So it's a very deep muscle and you need to be working in towards the shoulders. On that stroke up, I'm focusing more on the upper traps. So they narrow into the neck. On that pincer grasp, I was pretty gentle. It can feel really good if with the heels of your hands, you can just scoop these levator muscles up. Can continue that stroke down. Felt really nice to grab hold of the lats. And I really like to include this technique towards the end of a lot of my massages, back massages, to just stimulate and stretch out that connective tissue along the spine is so good to do. And before I finish, I do like to include a few strokes, including the arms, just to make everything feel more complete. You can bring that effleurage stroke all the way down to the hands if you want. And on your way up, you're just grazing the skin. If you were to try and press, you would just kind of fumble up the arms. It can feel really comforting to just put some pressure on those palms, ending with something super soothing. And that is all for today.